So let's get started, Julia. Can you just tell me in, a minute, who you are and what it is that you do and your organisation that you work for?
So my name is Julia, and I started as the in-house wellbeing lead at the end of 2022 at PFAS. We stand for Personal Functional Assessment Services, and we do assessments on behalf of the government. And before that, I worked in local government as a workplace lead, where I was working with lots of local businesses. But my background and passion really is health coaching. And so I'd been doing that for the NHS and private companies for a number of years.
Amazing.
Really passionate about kind of lifestyle and also putting the responsibility on the individual. But since I came into the organizational wellbeing lead role, I realized that it is a shared responsibility. And so I'm shifting my focus from just focusing on the individual. It's also what can we do as an organization to support people to make lifestyle choices.
How can you meet your workforce in the middle with that marriage of that personal responsibility and the organizational responsibility, and what is that little kind of point, that meeting point?
Yeah.
It's interesting, actually, 'cause it's already come up today with another guest, that little sort of hustle about where the responsibility lies. Partly because I think people have a personal well-being journey, right? And you'll know that as a health coach, you could give them all of the inspiration and education and support in the world, but unless they have a readiness to engage in that and to take action and to be accountable to themselves,
Exactly.
it doesn't work. Is that the experience you've had in that context as a health coach?
Yeah, because when I trained as a health coach, there's a cycle of change, and people, they are either in denial, or if they are in acceptance state, and only from a place of acceptance, people can start to make a change. And, you can't work with someone who is still in denial. You can guide them towards the acceptance stage that things need to change, but unless they're accepting that, you can't really help people.
Yeah, absolutely. So then, as an employer thinking about this, how do you handle that? Right, because you can't kind of take it. You might be able to spot that an employee needs some support or needs to engage in some services, or maybe perhaps would benefit. Need might be unfair, but would benefit from engaging in something.
Yeah.
But if you can't, if they won't do it, what does that mean for you as the employer?
It's about being patient with people and just planting seeds. And it's also about building relationships. We know that people change the most in a therapeutic relationship when there's trust and cooperation. And so in my role, I take a long time to build trust with individuals. I know that change isn't overnight. So I might speak to someone for 10 hours until they actually realize, okay, I should maybe engage with EAP. So I'm very patient with them, and it's about a non-judgmental approach.
Yeah.
And in all my conversations, I'm not judgmental, and I think it takes time to build that, relationship.
Wow, your organization sounds really lucky to have you, like your skill set in the midst of that role that you do, because it's not always the case, right? There's not always people doing roles like yours who actually have that training to be able to empathy and understanding of actually the methodology to how to support employees. Incredible. Okay, so are you able to use your practice as a coach in the workplace?
Yes, I think it's really great to have these transferable skills. And in some ways, I still identify with that role as a health coach. And obviously, I've got my business hat on as well. And I know that we need to meet targets and improve on productivity, reduce absence rates. But we can't do that unless we treat people as individuals.
Yeah.
And I use a lot of my, empathy, listening skills, open questioning, non-judgmental approach, coaching skills. I've got lots of coaching training, and I use that with line managers as well. We've trained our line managers in coaching skills.
Amazing.
And so we want them to have those skills as well to support their team and give them ownership. It's not just going back to responsibility. It's not just my responsibility. It's empowering them that they can have well-being conversations as well. Only because I'm the well-being lead doesn't mean that everything sits within my responsibility alone.
Great, yeah. And so maybe controversial question, but so you work for a government organisation. How's it been received, this approach? Because this is quite a soft, holistic approach.
Yes, I've been really lucky that I've gone into a company that already has leadership buy-in. So that was the first role they've created as a wellbeing lead. And that already shows that the directors actually realized we have demand for this role. We want someone to focus holistically, solely on well-being, and that someone is dedicated in that role. And so it has been actually very easy for me to step into this role in this organization.
Amazing. Oh, you must be loving work.
Yeah.
I mean, obviously everyone gets tired and stressed and overwork occasionally, but like how fulfilling to be able to do this work with people who are in the workplace needing this support.
I mean, it obviously is not an easy role. You have business targets and things don't always go to plan. And as I said, change doesn't happen overnight. So there are targets. There are also difficult conversations I have one-to-one, but it makes it all worthwhile in the end.
Yeah, yeah. Okay, so we were chatting before we came in here, in our warm-up chat about a Wellbeing Champions program network that you've created internally to support the workforce. Can you tell me a little bit about that journey of kind of, finding your champions and the training that you might have done and how you support them?
Yes, so I identified that I can't do this alone, and I wanted a team of people to be an extension of my role as a wellbeing lead, to be on the ground because they work with their colleagues day to day. They know their teams well. They can hear feedback and really promote engagement much more than I can company-wide. And so I went out and did a recruitment process, and I went company-wide and sent an email saying, these are the certain skills I'm looking for as a champion. If you meet those, please send me a couple of lines of why you'd be interested to be a champion. It is a voluntary role, but we'll get together every couple of months and do some team building, and you'll do an online course through Every Mind. I think it's called Every Mind Matters or Every Mind at Work, actually, by Paul. And I've signposted all of them to the online course, and they've completed that.
Great.
Some have been exempt because it does mention suicide in the course, and so I have otherwise trained them on what it takes to be a wellbeing champion.
Yeah.
And the initial meeting, I was really clear about the difference between a wellbeing champion and a mental health first aider. I did not want these people to be there just for crisis situations. I wanted them to promote people's wellbeing and engagement before people reach crisis.
Yeah. Well, as I said before, don't get us started on the challenges with mental health first aid. As great as it is, there is a need for more, right? A more rounded program to help people, to support peers in the workforce. So just practically then, because there'll be people listening to this who might be thinking about establishing some sort of wellbeing ambassador network or champion network. So numbers wise, so workforces, how many people?
We're about 150 people.
Okay, and you've got how many champions?
12 at
12.
the moment.
And do people stay in the role long term? Do they kind of rotate? Do you have a cohort for a year and then recruit again? What's it looking like so far?
So I look at kind of what I need. Obviously, some people move on to other organizations. And so I kind of look at, okay, I ideally want at least one person in every team. And we are geographically located all over the Southeast. And so I kind of look for 1 or 2 champions within each team. And so that every team is covered with a champion, and that's currently what I'm looking for.
Yeah, amazing. And so in terms of the sort of impact of that so far, because I guess the big old question is around measurement and impact, what can you say on that?
I think it's very difficult to put into numbers, but we can see that our champions have more of a voice, and they are supporting with my initiatives. For example, every Wednesday I send a Wellbeing Wednesday email, and I have involved some champions to help me actually email those across the company on behalf of me. There have been some great new ideas by our champions, and they've been able to contribute within their team, and there's been fantastic feedback. So we have seen improvements, which is very difficult to put into numbers.
Yeah, but there's some sort of feedback mechanism or way of kind of anecdotal feedback and stories.
Yes, with sharing of ideas and new initiatives being created within teams, improved engagement and motivation, really.
Love it. It sounds like there's an element of creativity that's essential in this work. And that's certainly something that we feel in our engagement with, our clients and our membership base, that actually there's some kind of key skills that are needed by people who either do your job or do the job of the wellbeing champions or ambassadors. Things like empathy, creativity, innovation, being open-minded. Any other skills that maybe you'd say were kind of quite key for you in the recruitment process?
For a champion or a wellbeing lead?
Well, I guess both, really.
I think you've got to think outside of the box and be really take every day at a time and be patient with the process. But you have to be also focused in data driven. You do have to understand the business side of things as well as having the well-being skills. And that's a complicated kind of two polar opposite skills, the soft and the hard skills.
Yeah, that is tough, isn't it? And so, like, because ultimately, like, people talk about the why, don't they? Like, what's your why, in the work that you do, or just in general. I guess it's fair to say in this context, like, the why, of course, it's about people. It's about their happiness, their support, their feeling of being held and backed by their organization, commitment they've made to the business. But it's fair that there's a why that's to do with the organization's aims and productivity and cost.
I think a lot of people that come into a well-being lead role are passionate about well-being for one way or another. And I didn't know starting out as a health coach, I'll end up in workplaces.
Yeah.
And it was just an interesting transition. But I do have a personal why. And few jobs ago, I actually was bullied by a line manager and I didn't have support. And I think now as my role, I wish at the time I had someone who does my role to speak to. And I didn't feel able to speak to colleagues or obviously my line manager or HR. And so it was quite an isolating time. And I think that is my why, that I don't want anyone to feel the way I did in that role.
Yeah. Oh, there's so many different directions to go in now that you've told me about that. And I love that there's, not that happened to you, but I love that this is coming from a place of like lived experience as to why and this is so important. So just going back then to that, you didn't expect to be ending up inside an organization in this type of a role necessarily when you were working as a health coach. For the benefit of people who are perhaps, still, or I guess it's everyone really, but like steering their careers in certain directions, because our audience is from lots of different sort of places, perspectives, and coming into this world of work. You're sometimes even getting like PTs ending up in these roles. What do you think is, important about navigating your way into this world of work?
I do think it's really useful to have some form of well-being background, whether that's from being a nutrition coach maybe, or working in the NHS, even as a healthcare assistant. So whichever route you want to take. But I think it's really important to know the business side of things and understand, if you do want to work in this, you need to understand organizational goals. I actually studied business as a degree. And again, I didn't know that I could use both the business side of things and the health coaching and marry the two into one role. And there are so many transferable skills from that. And I do think some business skills are important to understand, leadership and motivation at work, the whole idea around job design and how you get people to do, great work and productivity. And so some form of leadership course may be useful.
Yeah, absolutely. And so how did that happen for you? What was the point where you were like, oh, okay, maybe I could take these skills into the workplace to support employees?
I don't know how it happened. I just think it evolved into this role, and where we did our upskilling of our line managers, I was able to use the business skills that I've learned. And so it is really helpful to kind of have a bit of an understanding of how to manage people and, what it requires for a business to be successful, because, empathy and the soft skills are great, but the hard skills are also important to know, and how to write reports, for example. How can you evidence what you're doing? And that's what is really important for senior leaders.
Yeah. Absolutely. Okay, so one thing we've been talking about is this sort of shift in discussing well-being as a benefit to the conversation about it being an outcome.
Yes.
What are your thoughts on that?
Interestingly, I was thinking about this on the way here. I think that well-being isn't just an initiative you put in. Well-being is actually a symptom of an organizational culture. And so you could have all the best benefits, but if the organizational culture isn't right, it's not going to be good for well-being. It's to do with, how are your policies, HR policies, do they promote well-being? How is the workload? How is the job designed? How are health and safety practices? And so all these come together to create well-being. And it's not just a simple, okay, let's buy people coffee vouchers and that's going to help their well-being.
Yeah, so sort of really looking at it from the perspective of the output of your effort as being someone's measure of their well-being. So yeah, you can have all of those brilliant things in place, but you can still have people who are struggling. Talking of which, obviously it's incredible that we've, here today at the Watercooler, there's such a buzz and there's so much going on. Loads of interesting organisations here talking and having these conversations. But people are still really stressed. I don't mean the people here, but the workforce is really stressed. And, people are experiencing more mental health pressures, physical health pressures than ever before. We've got the odds are stacked against us with the cost of living crisis and the various like external challenges that we've got. Do you think we're getting something wrong? Or has there been progress? We've got evidence here that loads is happening, conversations happening, but people are still a bit screwed.
Yes, I think it's really understanding what is happening on an individual level, and organizations are getting the cost of what's happening in the economy, what's happening with what's happened with the pandemic, and so there are so many factors. Workplace stress should not add to that, hopefully. So we need to understand individuals and all the things contributing. And I do think we're facing a really difficult point where everyone is stressed and we don't know how to fix it.
Yeah, yeah. Well, that's what is like a bit of a conundrum for us, especially from a community point of view. Like we're all talking about it, we're having great conversations and there's loads going on, but it's still like we're still in a bit of a sticking point. One thing that I was thinking about is maybe it's because the external landscape changes so much all the time, like, big pressures on cost of living, for example. So actually these services and not services, but these policies and systems that we have internally, they actually need to be really responsive. But I know with North Bristol NHS Trust and their staff wellbeing programme, which is a huge network, I mentioned it before, they were really quick to respond to the financial wellbeing messaging that was happening as a result of the cost of living crisis, because of course they've got a workforce of people who are really like, underpaid dramatically, struggling to, having professional qualifications and clinical qualifications, helping the health of other people in the population, but unable to, make ends meet and pay for childcare. It's just, it's crazy. But, they did put really great financial wellbeing systems in place, and realistic ones as well, like an app that allows you to draw down some of your salary ahead of time. If there's just that bill that needs to get paid, or you need to pay for childcare or something like that, comes with risks, but a really great thing to have because we're so used to just getting paid once a month or whatever. So yeah, I think there's a need for like a responsiveness as well, which is tough in a job like yours where you're, it's taken a long time, isn't it, to get things off the ground and have the discussions, get budgets. How do you respond quickly to things that are happening externally?
Yeah, so it's about gaining data as well, because you want to understand what it is specifically affecting your workforce. So, for example, for us, we are at least 70% women, and we know that women are caretakers, and it's just understanding what goes on for these families, and we know that the NHS is struggling, for example, with workload. So if we with waiting lists, and if we know that, what can we provide internally to support people in getting doctor's appointments? Because we know if people don't get that, they won't get well enough. They may get into a crisis situation. So could we offer private health insurance so that they have an alternative option to go and be seen?
Yeah, yeah. Or even if you can't do the private health insurance, just get like one of those Go Doctor type, a bit like the EAP, like just a phone call people can have with a clinician. Yeah, you're absolutely right. So just sort of like getting ahead of the issue a little bit. Yeah, it's funny. It's interesting you mentioned women, because I've already had this conversation once this morning about female weighted workplaces because of the life cycle. When you look at women's health from a life stage perspective, there's constantly something like we kind of think, yeah, we need to talk about menopause now because so many women, it's an aging population, so many women experience menopause. But before menopause, there's a whole load of other stages. There's the postnatal period. There's childbirth, there's pregnancy, there's menstrual cycles which start before you even get into the world of work, and all of the different sort of female health gynecological conditions that we experience, they're not uncommon. This whole sort of life cycle it's always up. There's always something, isn't there, that women are experiencing. So if you've got a significantly, female workforce, and you need to expect, shouldn't be a surprise.
Yeah.
You need to expect that there's going to be things that those women need.
Yes, yeah, and it got me thinking there are some great providers, for example, fertility, and
Yes, love them.
I use them myself, but actually I found out about my gym. They gave me a discount for fertility. But then I thought maybe the workplace, now that, we are primarily women, and that is another subject that isn't talked about. I know menopause and maybe menstrual cycles is talked about, but not fertility journey.
Yeah, absolutely. I'm a person that's been through a fertility journey twice, 2 babies through IVF. Thank goodness, very lucky. So yes, absolutely. Like, I think and this is not to be critical of the NHS organisation that I work for, but when I did look at the policy around fertility, it was 2 lines long. It was sort of like, talk to your manager, we will do our best to support you.
Yes.
I was grateful of the conversation, but obviously I felt scared to have the conversation because it meant that they knew that eventually I would sometime need some time off, and then also then actually be having a baby, hopefully, which fortunately did happen. But they're tough. They're really tough truths, but we, for some reason, aren't there, even though we've known that women experience these things.
But I think that, this may be an unpopular opinion. I think that things like baby loss, for example, the policies should extend to men as well, because let's not ignore that those men also struggle, because fertility can affect men as well. And if it affects their partner, they are also emotionally affected. So in order to be really inclusive, we need to include our men in what they are struggling with.
Yeah, absolutely. Well, I think I went to over 30 hours of appointments at my IVF clinic, and I wasn't trying to sort of have a go at my husband, but I was trying to sort of say, look, this shouldn't just be me. And he has a very supportive employer. I was like, what does your employer say about you in this journey? And the answer was nothing. But yeah, I needed him there sometimes. And, he could take annual leave or whatever, or wing it on a lunch break. But it's a lot.
Exactly.
It's a lot. So, yeah, it should be inclusive of men. And this, and likewise, there's men's health issues that women can help with too.
Absolutely.
So, yeah, the gender discussion is really important. Right, I think we might be getting a bit of like a bit of a thumbs up on time. And also, I don't want to take too much more of your time. Last question. What do you do for you to support your own well-being, self-care, that kind of thing?
Well, I think we spoke earlier, I was quite clear that I don't come to London 2 consecutive days, and we just moved near the countryside, so I do spend a lot of time in the garden now, but really I'm also a dance fitness instructor.
Nice, love
so
it.
I do a lot of dance in the garden, and just anywhere I go, and in my room, and so I do dance at home in my lunch breaks. So I do think music is really powerful for mental health.
Yeah, it's a really good escapism, isn't it? Amazing. Boundaries, I guess, with like knowing that you only want to come to London for 1 day max. Like, it's too confronting, isn't it, sometimes? So knowing that that's enough for you is really important. Love it. Amazing. Well, thank you, Julia. I really appreciate
It's been lovely to meet you. Thank you.
How was your first podcast?
It's been really great. Thank you.
Good. I'm glad you enjoyed it.